Our top focus this morning is on the Omicron threat. The variant is spreading across the world. Over 17 countries so far have reported and confirmed cases of the Omicron variant of coronavirus. And in such a situation, India is getting geared up to tackle this latest threat. The lower house of the parliament, Lok Sabha, is likely to discuss the issue today. The mutated variant of COVID-19 will be discussed in Lok Sabha under the rule of 193. Discussion under this rule essentially doesn't involve a formal motion before the House. Union Health Minister Mansukh Mandavia is likely to discuss the mutated variant as well as the measures being taken by the government to prevent the transmission of Omicron. Now, the discussion is expected to happen at around 2 p.m. this afternoon in the Lok Sabha. In the wake of Omicron, the Maharashtra and Delhi governments have asked the central government to ban flights from South Africa and concerned hotspot countries. The centre has already directed all states and union territories to screen and test international passengers rigorously. More than 19 countries have reported cases of Omicron so far. Fortunately, as of now, no cases have been reported here in India. And to what the WHO chief has had to say on the new variant and the information that we have at hand so far about Omicron.
We shouldn't need another wake-up call. We should all be wide awake to the threat of this virus. But Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us. We're living through a cycle of panic and neglect. Hard-won gains could vanish in an instant. Our most immediate task, therefore, is to end this pandemic.
Let's take this across to Vidya. She's joining us live from Mumbai. Remember that the new international guidelines come into effect today. So she's reporting for us from the Chhatrapati Shivaji International Airport. Vidya, good morning. Mumbai, we're seeing a lot more steps being taken by the authorities, so much so that people and travelers, we understand, who come from the at-risk nations have to mandatorily quarantine, and that is institutional quarantine.
Well, certainly, in fact, the passengers who will be coming from high-risk countries, there are about 11 to 17 of these countries. All of them will be, segregated from the passengers who are coming from non-high-risk countries. And as soon as the segregation happens, heavy testing will be done. There are many counters inside the airport that have been opened up for RT-PCR. And if, in case a person has transit, route that they'll be taking, then immediate antigen tests will also be done. So certainly, apart from quarantining facilities, there are also heavily testing that will be done right here at the airport, so that the spread of the virus can really be contained right here.
Okay, so we're seeing all of the new travel guidelines coming to effect today. Additional screening, additional testing being done, particularly at airports across the country. Vidya, for the moment, thank you very much for joining us with all of those details. Now, there is a lot of concern over the Omicron variant. And as I mentioned, at least 19 countries so far have reported cases of this variant. Now, it was first detected weeks back in South Africa, which had confirmed the first case of the Omicron variant. Let's get you now a ground report on what the situation right now is in South Africa. Have cases gone up? Is it deadly? Is it highly transmissible? All those details in our next report.
Omicron has spooked the world. The super mutant is spreading fast. At least 19 countries have registered Omicron cases. The fast spread of the virus has prompted many nations to shut their borders to visitors from high-risk countries, including South Africa. Omicron, a coronavirus variant with around 50 mutations, was first found in Gauteng province of South Africa. Today, the city of Tshwane in Gauteng, just 85 kilometers away from the South African capital city of Johannesburg, accounts for more than half of the country's infections. India today visited Johannesburg to get the real picture on the ground.
This is OR Tambo International Airport, and as we can see, well, there's not many people that are leaving at this very moment, as a lot of them were of course departing, you know, on Saturday and Sunday. But this is just a drive-through through the airport here at OR Tambo, and it's quite clear that sooner or later we are going to be seeing more people, of course, leaving to go home after the Omicron variant was discovered here in South Africa.
While a sense of normalcy still persists on the streets, there is an underlying fear of the situation getting worse.
This is Voortrekker Street, one of the main economic streets here of this part of Johannesburg, and it's quite clear that it is very busy at this moment. But what a lot of people are going to be worried about and questioning is whether this will change, whether this will be very quiet, whether this will be less than what we see right now, if the COVID-19 cases continues to rise.
The Omicron surge is a big concern for the migrant population, away from home in search of a better standard of living.
जब से कोविड का अनाउंस हुआ है, जब से बिजनेस डाउन से डाउन होता जा रहा है और बिजनेस में कोई इम्प्रूवमेंट नहीं है, कस्टमर स्कैर्ड हैं और यहाँ हम सर्वाइव नहीं कर पा रहे हैं। अब हम ये सोच रहे हैं अब हमें क्या करना है, किस तरीके से हम अपनी फैमिली को सर्वाइव करेंगे। लॉट ऑफ प्रॉब्लम्स हैं यहाँ पर।
South Africa witnessed panic buying when the last lockdown hit the country. Now supermarkets have restocked in case President Cyril Ramaphosa announces another lockdown.
The people might come more and buy some more fruit and veg to boost their immune system. We'll have to wait and see what happens. That did happen in the other times. The people came and they did a bit of buying extra. People aren't panic buying anymore and that type of thing. But let's see. It should affect it, but not really anymore.
I'm standing here at Netcare Lakeview Hospital here in the eastern part of Johannesburg. The hospital has said off the record that they are very prepared for the Omicron variant, which is going to start taking effect in the next few weeks. So the question we have to ask ourselves is government, are the private hospitals like this over here prepared for the variant, and are they ready to go ahead and deal with the influx of patients that are going to come? Well, that's all we have for you here. My name is Faraz Patel. I'm reporting from Johannesburg, South Africa for India Today.